Question 1. What factors determine the most appropriate and compliant methods for a registered behavior technician, RBT, to meet their ongoing education and training requirements for certification renewal? Option A. The RBT's engagement in structured learning activities, supervision that focuses on skill enhancement and professional development opportunities that are directly aligned with the RBT role and approved by the BAC. Option B. The RBT's reliance on informal learning through peer discussions and casual observation of experienced practitioners without formal documentation or BAC endorsement. Option C. The RBT's personal interest in a broad range of professional development topics, regardless of direct relevance to the RBT scope of practice or BAC approval. Option D. The RBT's assumption that any activity that enhances general professional skills, such as time management or communication, will satisfy continuing education requirements. The correct answer is C. The RBT's personal interest in a broad range of professional development topics, regardless of direct relevance to the RBT scope of practice or BAC approval. Explanation. The scenario presents a challenge for a registered behavior technician, RBT, who has been practicing for several years and is seeking to maintain their certification. The core challenge lies in identifying the most effective and compliant methods for fulfilling the ongoing education and training requirements mandated by the Behavior Analyst Certification Board, BAC, for RBTs. This requires understanding the specific nature of acceptable continuing education, supervision, and professional development activities that align with ethical standards and regulatory expectations. The correct approach emphasizes actively seeking out and engaging in training opportunities that are directly relevant to the RBT scope of practice and that are approved or recognized by the BAC. This includes attending workshops, completing relevant coursework, and participating in structured supervision that focuses on skill development and ethical conduct. This approach represents best professional practice because it directly addresses the BAC requirements for maintaining competence and ethical practice. The BAC mandates continuing education to ensure RBTs remain up to date with the latest research, techniques, and ethical guidelines in behavior analysis, thereby protecting the public and ensuring the quality of services provided. Adhering to these requirements is a direct ethical and regulatory obligation. An incorrect approach would be to assume that any professional development activity counts towards the requirement without verifying its relevance or BAC approval. For example, attending a general professional development seminar unrelated to behavior analysis or ABA principles would not fulfill the RBT's continuing education requirements. This represents an ethical failure because it demonstrates a lack of diligence in meeting professional obligations and could lead to the RBT's certification lapsing, potentially impacting their ability to practice and the continuity of care for clients. Another incorrect approach would be to solely rely on informal learning or anecdotal advice from colleagues without structured training or supervision. This fails to meet the BAC requirement for documented and verifiable continuing education and supervision, which is crucial for accountability and ensuring competency. The professional decision-making process for similar situations should involve a proactive review of the current BAC RBT handbook and any relevant updates regarding continuing education and supervision requirements. RBTs should maintain a log of all professional development activities, ensuring they are relevant and meet the specified criteria. When in doubt about the acceptability of a training or supervision activity, it is best practice to consult the BAC directly or seek guidance from a qualified BCBA supervisor. This systematic approach ensures compliance, promotes continuous professional growth, and upholds the ethical standards of the profession. Question 2. When evaluating session data for a client's challenging behavior, an RBT observes that the frequency of the behavior has decreased slightly over the past 3 sessions, but the variability in the data has also increased. The intervention has been in place for 2 weeks. What is the most appropriate next step for the RBT? Option A. Immediately recommend to the supervisor that the intervention be changed due to the increased variability. Option B. Focus solely on the slight decrease in frequency and report that the intervention is showing positive results. Option C. Conclude that the intervention is not effective because the decrease is not substantial and suggest discontinuing it. Option D. Continue the current intervention as planned and collect more data to observe the trend over a longer period. Correct answer is D. Continue the current intervention as planned and collect more data to observe the trend over a longer period. Explanation. This scenario presents a common challenge for registered behavior technicians, RBT, where they must interpret data to inform intervention decisions, but the data itself may be ambiguous or incomplete. The RBT's responsibility is to ensure that interventions are effective and ethically applied, which necessitates accurate data analysis and interpretation. This requires careful judgment to avoid making decisions based on superficial trends or personal biases, and instead rely on systematic analysis aligned with best practices and ethical standards. The correct approach involves systematically reviewing the collected data, considering the target behavior, the intervention implemented, and any relevant contextual factors. This approach aligns with the BACP RBT Ethics Code, specifically Standard 101, Beneficence and Non-Maleficence, which requires RBTs to act in the best interest of the client and avoid harm. By analyzing the data to determine if the intervention is producing the desired effect, the RBT is fulfilling their ethical obligation to provide effective services. Furthermore, Standard 201, Practitioner Responsibility, mandates that RBTs only practice within their scope of competence, which includes the ability to analyze and interpret data to inform practice. An incorrect approach would be to make a decision based solely on a perceived immediate change, without considering the overall trend or consistency of the data. This could lead to premature discontinuation or modification of an intervention that might be effective over a longer period, or conversely, continuing an ineffective intervention. Such an approach could violate Standard 101 by potentially causing harm through ineffective treatment. Another incorrect approach would be to rely on anecdotal observations or the opinions of others without a systematic review of the objective data. This disregards the importance of empirical evidence in behavior analysis and could lead to decisions that are not client-centered or data-driven, potentially violating Standard 201 by practicing outside the bounds of competent data analysis. Professionals should use a decision-making framework that prioritizes objective data analysis. This involves 1. Clearly defining the target behavior and measurement procedures. 2. Collecting data systematically and accurately. 3. Visually analyzing the data for trends, variability, and level. 4. Considering the impact of the intervention on the target behavior. And 5. Consulting with the supervising BCBA when interpretation is unclear or when significant changes to the intervention plan are being considered. This systematic process ensures that decisions are evidence-based and ethically sound. Question 3. Process analysis reveals that a registered behavior technician, RBT, is tasked with collecting data on a client's on-task behavior during a structured learning activity. The operational definition of on-task behavior is the client's engagement with the assigned learning materials for a continuous period of at least 30 seconds. The RBT is considering several data collection methods. Which method would be most appropriate for accurately measuring this specific behavior? Option A, frequency recording. Option B, latency recording. Option C, partial interval recording. Option D, duration recording. Correct answer is D, duration recording. Explanation. This scenario presents a common challenge in applied behavior analysis, selecting the most appropriate data collection method to accurately capture a target behavior's occurrence and intensity. The professional's task is to analyze the behavior and its context to determine which method will yield the most meaningful and actionable data for intervention planning and evaluation. This requires a deep understanding of the characteristics of each data collection method and how they align with the specific nature of the behavior being observed. The correct approach, which involves selecting duration recording for behavior that is defined by its length of occurrence, represents best professional practice because it directly measures the construct of interest. Duration recording provides a precise measure of how long a behavior lasts, which is crucial for behaviors like on-task behavior or tantrum duration. This aligns with the RBT's ethical responsibility to collect accurate and relevant data that directly informs intervention effectiveness, as mandated by ethical codes that emphasize data-driven decision-making and client welfare. An incorrect approach, such as using frequency recording for a behavior defined by its duration, would fail to capture the essential information needed for effective intervention. Frequency counts only the number of times a behavior occurs, not how long it lasts. If the goal is to reduce the time a child spends out of their seat, simply counting how many times they get out of their seat without measuring the duration of each instance would provide an incomplete and potentially misleading picture. This failure to collect relevant data could lead to ineffective interventions and a lack of progress for the client, violating the RBT's duty to provide competent services. Another incorrect approach, using latency recording for a behavior that is not defined by the time to initiate, would also be inappropriate. Latency measures the time between a stimulus and the initiation of a response. If the target behavior is time spent engaging in independent reading, latency recording would be irrelevant as it focuses on the start of the behavior, not its continuation or overall occurrence. This misuse of a data collection method demonstrates a lack of understanding of its application and can lead to the collection of irrelevant data, hindering effective analysis and intervention. Finally, using interval recording without a clear rationale for its application, such as when a behavior is too brief or too continuous to accurately capture with other methods, would also be an incorrect approach. While interval recording can be useful for behaviors that occur intermittently, applying it to a behavior that is clearly defined by its duration or frequency without considering the other methods would be inefficient and potentially less accurate. This demonstrates a failure to critically evaluate the most appropriate method for the specific behavior and context, potentially leading to wasted effort and less precise data. Professionals should employ a decision-making process that begins with a clear operational definition of the target behavior. They must then consider the nature of the behavior. Is it defined by its occurrence frequency, its length of time duration, the time to initiate latency, or its presence within specific time intervals? The context of the observation and the goals of the intervention are also critical factors. By systematically evaluating these aspects, the RBT can select the data collection method that will yield the most valid, reliable, and useful information for supporting the client's progress. Question 4. Market research demonstrates that parents of children receiving ABA services often seek to share progress updates with other professionals involved in their child's care, such as pediatricians or school psychologists. An RBT is working with a client whose parents have expressed a strong desire for the child's pediatrician to be aware of specific behavioral progress made during therapy sessions. The RBT has not yet obtained explicit, written consent from the parents to share this information. What is the most appropriate course of action for the RBT in this situation? Option A. The RBT should share detailed session notes with the pediatrician, as this provides a comprehensive overview of the client's progress and supports interdisciplinary communication. Option B. The RBT should document the parent's request and inform their supervising BCBA, who will then guide the process of obtaining informed consent from the parents before any information is shared with the pediatrician. Option C. The RBT should proceed to share general progress updates with the pediatrician, as this is in the client's best interest and the parents have expressed a desire for collaboration. Option D. The RBT should inform the parents that they cannot share any information with other professionals without a formal request from the pediatrician's office. The correct answer is B. The RBT should document the parent's request and inform their supervising BCBA, who will then guide the process of obtaining informed consent from the parents before any information is shared with the pediatrician. Explanation. This scenario presents a common challenge in behavior analysis, where the desire to share information for client benefit clashes with the stringent requirements of confidentiality. The RBT must navigate the ethical imperative to protect client privacy, while also considering how to best support the client's progress. The professional challenge lies in balancing these competing interests, recognizing that unauthorized disclosure can have severe legal and ethical consequences, including harm to the client's trust and potential legal repercussions for the RBT and their supervising BCBA. The correct approach prioritizes client consent and adheres strictly to the BAC Professional and Ethical Compliance Code for behavior analysts, specifically the sections on confidentiality and privacy. Obtaining informed consent before sharing any client information is a cornerstone of ethical practice. This ensures the client, or their legal guardian, is fully aware of what information will be shared, with whom, and for what purpose, and has the autonomy to decide. This approach upholds the client's right to privacy and maintains professional integrity. An incorrect approach that involves sharing information without explicit, informed consent, even with the intention of improving client outcomes, constitutes a violation of confidentiality. This directly contravenes ethical codes that mandate protecting client information and can lead to a breach of trust, damage to the therapeutic relationship, and potential disciplinary action from the back. Sharing information with colleagues without a legitimate clinical need to know and without consent is also a breach. Furthermore, assuming consent or relying on implied consent is insufficient. Explicit, documented consent is required. Professionals should employ a decision-making process that begins with identifying the ethical principles at play, particularly confidentiality and client autonomy. They should then consult relevant ethical codes and legal regulations. If unsure, seeking supervision from their BCBA is crucial. The process involves clearly defining the purpose of information sharing, identifying the recipient, and determining if consent is necessary and obtainable. If consent is obtained, it must be documented. If consent cannot be obtained or is not appropriate, the professional must find alternative, ethical ways to support the client's needs without compromising confidentiality. Question 5. Strategic planning requires an RBT to consider how to best utilize their supervision sessions to enhance their skills and address client challenges. When an RBT encounters a particularly complex client behavior that is proving difficult to manage with current strategies, what is the most effective and ethically sound approach to professional development and supervision? Option A. Proactively schedule a dedicated portion of the next supervision session to discuss the challenging behavior, present data, outline current intervention attempts, and collaboratively brainstorm alternative strategies and skill development needs with the supervisor. Option B. Avoid discussing the challenging behavior in supervision to prevent the supervisor from thinking the RBT is not competent, and instead focus on less complex client cases during supervision discussions. Option C. Focus solely on completing the required supervision hours by reviewing session notes and administrative tasks, without delving into the specifics of challenging client behaviors or seeking skill development guidance. Option D. Independently research and implement a new, unproven intervention strategy for the challenging behavior, hoping it will be successful before the next supervision session. Correct answer is A. Proactively schedule a dedicated portion of the next supervision session to discuss the challenging behavior, present data, outline current intervention attempts, and collaboratively brainstorm alternative strategies and skill development needs with the supervisor. Explanation. This scenario presents a professional challenge because it requires an RBT to balance the immediate needs of a client with the long-term requirements for their own professional growth and competency, as mandated by ethical guidelines and supervision requirements. The RBT must navigate the potential for over-reliance on their supervisor for direct client intervention versus utilizing supervision time for skill development and case conceptualization. The correct approach represents best professional practice because it prioritizes the RBT's ongoing development and adherence to supervision standards. By actively seeking to discuss challenging behaviors and intervention strategies with their supervisor, the RBT is engaging in the core purpose of supervision, to enhance clinical skills, ensure ethical practice, and improve client outcomes through expert guidance. This proactive engagement with supervision directly aligns with the BAC requirements for ongoing supervision to maintain certification and ensure competence. It demonstrates a commitment to professional growth and client welfare by leveraging the supervisor's expertise to refine service delivery. An incorrect approach that involves the RBT attempting to independently implement complex or novel intervention without prior discussion and approval from their supervisor is a failure to adhere to ethical standards and potentially the RBT's scope of practice. This bypasses the critical oversight function of supervision, which is designed to prevent errors and ensure interventions are evidence-based and appropriate for the client. It also fails to utilize supervision time effectively for learning and skill refinement. Another incorrect approach, such as avoiding discussion of challenging cases due to fear of judgment, represents a significant ethical failure. Supervision is a safe space for learning and problem-solving. Avoiding such discussions hinders professional development and can lead to suboptimal client care if challenges are not addressed collaboratively. This also undermines the supervisory relationship and the RBT's commitment to continuous improvement. Finally, an incorrect approach that focuses solely on completing supervision hours without engaging in meaningful discussion or skill-building activities fails to meet the spirit and intent of supervision requirements. Supervision is not merely a transactional requirement, but a developmental process. This approach neglects the opportunity to learn, grow, and ensure the highest quality of service delivery, potentially leading to stagnation in professional skills and an inability to adapt to evolving client needs or best practices. The professional decision-making process for similar situations should involve a commitment to proactive communication with the supervisor. When faced with a challenging client situation or a desire to implement a new strategy, the RBT should schedule dedicated time during supervision to discuss these issues. This involves preparing specific questions, outlining the observed behaviors, detailing current intervention attempts, and articulating the desired outcomes. The RBT should view supervision as a collaborative learning opportunity, actively seeking feedback, asking clarifying questions, and demonstrating a willingness to learn and adapt their practice based on the supervisor's guidance. This approach ensures ethical practice, promotes professional growth, and ultimately benefits the client. Question 6. System analysis indicates that an RBT has been providing services to a client for several months. During this time, the RBT discovers that their sibling is in a romantic relationship with the client's parent. The RBT has not previously disclosed this developing personal connection to their supervising BCBA. What is the most ethically sound and procedurally correct course of action for the RBT? Option A. Continue providing services as usual, assuming the personal relationship will not affect professional judgment or client care, and address it only if a problem arises. Option B. Immediately inform the supervising BCBA about the developing personal relationship and request guidance on how to proceed, which may include modifying service delivery or transferring the client. Option C. Inform the supervising BCBA only if the personal relationship begins to directly interfere with session delivery or data collection. Option D. Discreetly attempt to gather information about the client's progress from the family member outside of official sessions to ensure everything is on track. Correct answer is B. Immediately inform the supervising BCBA about the developing personal relationship and request guidance on how to proceed, which may include modifying service delivery or transferring the client. Explanation. This scenario presents a common ethical challenge for registered behavior technicians, RBT, involving dual relationships and potential conflicts of interest. The RBT's personal relationship with the client's family member creates a situation where their professional judgment could be compromised by personal feelings or obligations. Maintaining professional boundaries is paramount to ensuring the client's best interests are prioritized and that services are delivered objectively and effectively, in accordance with the BAC Professional and Ethical Compliance Code for Behavior Analysts. The correct approach prioritizes the client's well-being and upholds ethical standards by proactively addressing the dual relationship. This involves open communication with the supervising BCBA to determine the most appropriate course of action, which may include modifying the service delivery plan, transferring the client to another RBT, or implementing strict boundaries. This approach aligns with the ethical principle of avoiding harm and ensuring that the RBT's personal relationships do not interfere with their professional responsibilities or the client's progress. An incorrect approach would be to continue providing services without disclosing the dual relationship. This violates the ethical obligation to maintain professional boundaries and avoid conflicts of interest. It could lead to biased decision-making, compromised objectivity in data collection and intervention implementation, and potential harm to the client if the personal relationship influences professional judgment. Another incorrect approach would be to attempt to manage the dual relationship independently without consulting the supervising BCBA. This bypasses the established supervisory structure designed to ensure ethical practice and client safety, and it fails to acknowledge the potential for unconscious bias. Professionals should employ a decision-making process that begins with identifying potential ethical conflicts. This involves recognizing situations where personal relationships might intersect with professional duties. Next, they should consult relevant ethical codes and guidelines, such as the BAC Code. Open and honest communication with supervisors is crucial. If a conflict is identified, the professional should explore all options to mitigate harm and ensure the client's best interests are served, which may involve seeking supervision, modifying service delivery, or terminating the professional relationship in an ethical manner. Question 7. The audit findings indicate that during a session, a client consistently engages in disruptive vocalizations immediately after being asked to complete a non-preferred academic task. The RBT observes that the vocalizations cease when the task is removed and a preferred item is provided. The RBT is tasked with implementing strategies to reduce these vocalizations. Which of the following approaches best addresses the function of the behavior based on the observed antecedent and consequence? Option A. Focus solely on increasing the intensity of verbal reprimands when vocalizations occur, as this is a direct consequence for the unwanted behavior. Option B. Implement a differential reinforcement of other behavior, DRO, procedure, reinforcing the absence of vocalizations for a specified interval, while also prompting the client to engage with the academic task. Option C. Provide the client with a preferred item immediately after the vocalizations occur to reinforce the cessation of the disruptive behavior. Option D. Immediately redirect the client to the academic task with increased verbal prompts and ignore the vocalizations until they stop. The correct answer is B. Implement a differential reinforcement of other behavior, DRO, procedure, reinforcing the absence of vocalizations for a specified interval, while also prompting the client to engage with the academic task. Explanation. This scenario presents a professional challenge because it requires the registered behavior technician, RBT, to interpret and apply the principles of behavior analysis in a real-world setting, specifically concerning the functions of behavior, antecedents, and consequences. The challenge lies in accurately identifying the function of a behavior when the presented information might be incomplete or open to interpretation, and then selecting the most appropriate intervention strategy based on that functional assessment. Careful judgment is required to ensure interventions are effective, ethical, and aligned with the client's treatment plan and the Behavior Analyst Certification Board, BACP, RBT Ethics Code. The correct approach represents best professional practice because it directly addresses the identified antecedent and consequence, demonstrating an understanding of how these environmental events influence behavior. By focusing on modifying the antecedent E, G, providing a choice, or the consequence E, G, reinforcing an alternative behavior, the RBT is applying evidence-based strategies derived from a functional assessment. This aligns with the BACP RBT Ethics Code, which emphasizes the importance of using behavior analytic principles to promote client well-being and to implement interventions that are based on functional assessments. Specifically, the RBT is expected to collect data and implement interventions as directed by the supervising BCBA, and this approach reflects that directive by targeting the environmental variables that maintain the behavior. An incorrect approach that involves ignoring the antecedent and solely focusing on punishment of the behavior fails to address the function of the behavior and is ethically problematic. Punishment-only strategies, without considering the antecedent or reinforcing alternative behaviors, can be aversive, may suppress behavior without teaching new skills, and can damage the therapeutic relationship. This violates the RBT Ethics Code's emphasis on using the least restrictive effective interventions and promoting client dignity. Another incorrect approach, such as solely focusing on the consequence without considering the antecedent, might be less effective if the antecedent is a strong motivator for the behavior. This could lead to an inefficient intervention that does not fully address the behavior's function. Furthermore, implementing interventions without a clear understanding of the function, or without supervision, can lead to ineffective or harmful practices, which is a direct contravention of RBT responsibilities. The professional decision-making process for similar situations involves a systematic approach. First, thoroughly review the client's behavior intervention plan BIP and any recent data. Second, identify the target behavior and its hypothesized function. Third, analyze the antecedent conditions that precede the behavior and the consequences that follow. Fourth, select an intervention strategy that directly targets the function by manipulating antecedents or consequences to decrease the target behavior and increase appropriate alternative behaviors. Finally, always consult with the supervising BCBA if there is any ambiguity or if the situation requires a modification to the BIP. This ensures that interventions are data-driven, ethically sound, and aligned with best practices in behavior analysis. Question 8. Operational review demonstrates that a registered behavior technician is tasked with tracking the number of times a client successfully initiates a conversation with a peer each day. The technician is considering how best to visually represent this data to show the client's overall progress in developing this social skill over a 6-week period. Option A. A scatter plot, as it can identify any patterns or correlations between conversational initiations and other daily events. Option B, a pie chart, as it can represent the proportion of days the client initiated a conversation versus days they did not. Option C, a cumulative record, as it will clearly show the total number of conversational initiations over time, illustrating the steady acquisition of the skill. Option D, a bar graph, as it can display the number of initiations for each individual day, allowing for easy comparison of daily performance. The correct answer is C, a cumulative record, as it will clearly show the total number of conversational initiations over time, illustrating the steady acquisition of the skill. Explanation. This scenario presents a common challenge in applied behavior analysis, where the visual representation of data must effectively communicate progress and inform treatment decisions to various stakeholders, including parents, supervisors, and the client themselves. The challenge lies in selecting the most appropriate graphing method to accurately depict the target behavior and its trends, ensuring that the chosen method aligns with the nature of the behavior and the goals of the intervention. Careful judgment is required to avoid misinterpretations that could lead to suboptimal treatment adjustments or a lack of understanding among those involved. The correct approach represents best professional practice because it prioritizes the clarity and interpretability of the data for the specific behavior being tracked. A cumulative record is the most appropriate graph for behaviors that are counted, and where the total number of occurrences over time is the primary focus, such as the number of words spoken or the number of tasks completed. This method clearly illustrates the rate of acquisition and the overall progress towards a goal, aligning with the RBT's ethical responsibility to accurately and effectively communicate client progress as outlined by the BACP RBT Ethics Code. An incorrect approach would be to use a bar graph for a cumulative behavior. A bar graph is best suited for comparing discrete data points or categories, such as the number of occurrences of a behavior during different sessions or conditions. Using it for a cumulative behavior would obscure the continuous nature of the progress and make it difficult to discern the rate of change over time, potentially leading to misinterpretations of the client's learning trajectory. This failure to select the most appropriate graphing method can be seen as a lapse in professional competence and a failure to accurately represent data, which could violate ethical standards related to data integrity and client welfare. Another incorrect approach would be to use a line graph for a behavior that is best represented cumulatively. While line graphs are excellent for showing trends over time, they are typically used for behaviors where each data point represents the frequency or duration of a specific occurrence within a given interval, not the total accumulation. Applying a line graph to a cumulative behavior might inaccurately suggest variability in the rate of acquisition that doesn't exist when viewed as a continuous accumulation, potentially leading to unnecessary or premature changes in the intervention plan. This misrepresentation of data can hinder effective decision-making and negatively impact the client's progress, potentially violating ethical obligations to provide competent services. The professional decision-making process for similar situations should involve a thorough understanding of the different types of graphs and their appropriate applications based on the nature of the target behavior and the data being collected. The RBT should consider the primary question the graph is intended to answer and select the graph that most clearly and accurately depicts this information. Consulting with the supervising BCBA is crucial to ensure the chosen graphing method aligns with the overall treatment plan and effectively communicates progress to all stakeholders, adhering to the BACP standards for data collection and reporting. Question 9. System analysis indicates that 2 registered behavior technicians, RBT, have independently collected data on the frequency of a client's disruptive vocalizations during a 30-minute session using a frequency count. To ensure the reliability of their measurements, what is the most appropriate next step for the RBTs to take? Option A. Have one RBT adjust their count to match the other RBT's count after a brief discussion. Option B. Average the frequency counts from both RBTs to create a single data point. Option C. Review each other's data sheets and discuss any perceived differences to reach a consensus. Option D. Calculate the percentage of agreement between the 2 RBTS frequency counts. The correct answer is D. Calculate the percentage of agreement between the 2 RBTS frequency counts. Explanation. Scenario analysis. This scenario presents a common challenge in applied behavior analysis, where the reliability of data collection is paramount for effective intervention. Ensuring that two observers independently record behavior in a consistent manner is crucial for making sound clinical decisions. The challenge lies in identifying the most appropriate method to assess this consistency, as flawed data can lead to ineffective or even harmful interventions. Correct approach analysis. The correct approach involves calculating inter-observer agreement, IOA, using a method appropriate for the type of data being collected. For interval recording, percentage agreement, or a more robust measure like Cohen's kappa, if accounting for chance agreement, is standard. This directly addresses the RBT's ethical and professional responsibility to collect accurate and reliable data, as mandated by the BACP RBT Ethics Code and Task List. High IOA provides confidence that the behavior is being measured consistently, allowing for accurate assessment of baseline, intervention effectiveness, and progress. This ensures that treatment decisions are based on objective, verifiable information, upholding the principle of beneficence. Incorrect approach is analysis. One incorrect approach would be to simply review the data sheets without performing a quantitative agreement calculation. This fails to provide an objective measure of reliability. The RBT Ethics Code emphasizes the importance of data-driven decision-making, and subjective review does not meet this standard. It also fails to address the potential for systematic bias or drift in observation. Another incorrect approach would be to average the data from the two observers without calculating agreement. Averaging can mask significant discrepancies between observers, creating a false sense of reliability. If one observer consistently overestimates or underestimates the behavior, averaging will not reveal this critical issue, potentially leading to misinterpretations of the intervention's impact. This violates the principle of accuracy in data collection. A third incorrect approach would be to discuss the discrepancies with the other observer and then adjust the data to match. This is a severe ethical violation, constituting data falsification. The RBT Ethics Code strictly prohibits misrepresenting data. IOA is meant to assess existing agreement, not to create agreement through post hoc manipulation. This undermines the integrity of the entire assessment and intervention process. Professional reasoning. When faced with collecting data for IOA, a professional should first understand the type of data being collected, e.g., frequency, duration, interval. Then they should select an appropriate IOA calculation method based on the data type and the specific requirements of their governing body, in this case, the BACP. The calculated IOA should then be reviewed to ensure it meets acceptable levels, often specified by supervisors or organizational policies. If IOA is low, the next step is to investigate the reasons for disagreement, e.g., unclear operational definition, observer drift, distraction, and implement training or clarification to improve future agreement, rather than altering existing data. Question 10. Risk assessment procedures indicate that a client has consistently demonstrated the target behavior of asking for a snack appropriately for the past 2 weeks, with a 90% accuracy rate during structured sessions. The supervising BCBA has noted that the behavior is now well established. What is the most appropriate next step for the registered behavior technician, RBT, regarding the schedule of reinforcement? Option A. Gradually transition to an intermittent schedule of reinforcement to promote maintenance and generalization. Option B. Implement a highly variable ratio schedule of reinforcement to maximize response rate. Option C. Continue providing reinforcement for every instance of the target behavior to ensure it remains strong. Option D. Immediately withdraw all reinforcement for the target behavior to encourage self-management. The correct answer is C. Continue providing reinforcement for every instance of the target behavior to ensure it remains strong. Explanation. This scenario presents a common challenge in behavior analysis, selecting the most effective reinforcement schedule to maintain a target behavior while ensuring the client's progress aligns with ethical and regulatory standards. The professional must balance the need for efficient behavior change with the long-term goal of generalization and maintenance, all within the RBT's scope of practice and under the supervision of a BCBA. The correct approach involves understanding the principles of continuous and intermittent reinforcement and applying them judiciously. Continuous reinforcement, CRF, is highly effective for establishing new behaviors because it provides a high rate of reinforcement for every instance of the behavior. However, behaviors acquired under CRF often extinguish quickly when reinforcement is withdrawn. Intermittent reinforcement, on the other hand, involves reinforcing a behavior only some of the time. This can be ratio-based, reinforcing after a certain number of responses, or interval-based, reinforcing after a certain amount of time has passed. Intermittent schedules are more resistant to extinction and are crucial for behavior maintenance and generalization. For a behavior that has been established and is nearing mastery, transitioning to an intermittent schedule is best professional practice. This aligns with the BACP ethical guidelines, which emphasize the importance of effective and efficient interventions that promote long-term client outcomes and reduce the risk of extinction when reinforcement is naturally thinned in the environment. An incorrect approach would be to continue with continuous reinforcement indefinitely for an established behavior. This is inefficient and can lead to the client becoming overly reliant on constant reinforcement, hindering generalization to natural environments where reinforcement is not always immediate or continuous. Ethically, this could be considered a failure to provide the most effective and efficient services. Another incorrect approach would be to abruptly withdraw all reinforcement once a behavior is mastered. This would likely lead to rapid extinction of the behavior, which is detrimental to the client's progress and violates the principle of providing services that are in the client's best interest. This also fails to adhere to the ethical requirement of ensuring behavior change is functional and maintained. A third incorrect approach might involve implementing a highly complex or unpredictable intermittent schedule without proper assessment or supervision, potentially leading to confusion for the client and inconsistent responding, which is not aligned with evidence-based practice or ethical service delivery. The professional decision-making process should involve a thorough assessment of the target behavior's current status, the client's individual needs, and the environmental context. The RBT, under BCBA supervision, should determine if the behavior is newly acquired or established. For established behaviors, the focus shifts to maintenance and generalization. This involves a systematic fading of reinforcement, moving from continuous to intermittent schedules, and selecting schedules that are appropriate for the behavior and the client's developmental level. Continuous monitoring and data collection are essential to evaluate the effectiveness of the chosen schedule and make adjustments as needed, always prioritizing the client's progress and well-being within the established ethical and regulatory framework. Question 11. The evaluation methodology shows that a client is exhibiting significant distress and resistance to a standardized assessment procedure, impacting the reliability of the data being collected. The RBT must decide how to proceed to ensure both ethical practice and the collection of meaningful information. Which of the following represents the most appropriate course of action? Option A. Adapt the assessment by breaking it down into smaller, more manageable steps, incorporating preferred activities between steps, and seeking the supervising BCBA approval for the modified procedure. Option B. Proceed with the standardized assessment as planned, ensuring all steps are completed regardless of the client's distress to maintain data integrity. Option C. Immediately discontinue the assessment and inform the supervising BCBA that the client is not cooperating, suggesting a delay in services. Option D. Develop a completely new, informal assessment on the spot that the RBT believes might be more engaging for the client, without consulting the supervising BCBA. The correct answer is A. Adapt the assessment by breaking it down into smaller, more manageable steps, incorporating preferred activities between steps, and seeking the supervising BCBA approval for the modified procedure. Explanation. This scenario is professionally challenging because it requires the registered behavior technician, RBT, to balance the need for objective data collection with the client's immediate comfort and engagement during an assessment. The RBT must adhere to the Behavior Analyst Certification Board, BACP, Professional and Ethical Compliance Code for Behavior Analysts, specifically focusing on the principles of assessment and the client's right to effective treatment. The challenge lies in selecting an assessment method that is both scientifically sound and ethically appropriate for the individual client's current state. The correct approach represents best professional practice because it prioritizes the client's well-being and dignity while still ensuring the integrity of the assessment. By selecting an assessment method that is less intrusive and more adaptable to the client's current state, the RBT is upholding the ethical principle of beneficence, ensuring the client's needs are met without causing undue distress. This approach aligns with the BACP emphasis on using the least restrictive procedures necessary to achieve desired outcomes and the importance of considering the client's environment and current functioning when selecting assessment tools. An incorrect approach that relies solely on a highly structured potentially aversive assessment without considering the client's distress would be ethically problematic. This could violate the client's right to effective treatment and potentially lead to a skewed assessment due to the client's avoidance or distress behaviors, rather than accurately reflecting their skill deficits or strengths. It fails to consider the principle of least restrictive procedures. Another incorrect approach that involves abandoning the assessment entirely due to minor client discomfort would be professionally unacceptable. This could be seen as a failure to provide effective services and a lack of commitment to the assessment process, potentially delaying necessary interventions. It might also indicate a lack of skill in adapting assessment procedures to client needs. A third incorrect approach that involves improvising a new assessment method without prior consultation with the supervising BCBA would be a direct violation of the RBT's scope of practice and the BACP ethical code. RBTs are trained to implement assessments designed by BCBA and are not authorized to develop or significantly alter assessment methodologies independently. This could compromise the validity and reliability of the data collected and pose a risk to the client. Professionals should use a decision-making framework that begins with understanding the assessment goals, reviewing the client's current behavior and environmental context, considering available assessment tools and their appropriateness, consulting with the supervising BCBA regarding any modifications or concerns, and prioritizing the client's dignity and well-being throughout the process. Question 12. The monitoring system demonstrates that during a structured play session, a client exhibits aggressive behavior, hitting a peer, on 3 occasions within a 15-minute interval. The Behavior Intervention Plan BIP for this client specifically outlines a negative punishment procedure for aggression, which involves the immediate removal of a preferred toy for 30 seconds following each instance of hitting. The RBT is present and observes the aggression. Which of the following actions best reflects the RBT's professional responsibility in this situation? Option A. Immediately remove the preferred toy the client is playing with for 30 seconds following each instance of aggression. Option B. Administer a brief, firm verbal reprimand to the client for hitting the peer. Option C. Introduce a less preferred activity for the client for 5 minutes after the 3rd instance of aggression. Option D. Ignore the aggressive behavior and continue with the play session as planned. The correct answer is A. Immediately remove the preferred toy the client is playing with for 30 seconds following each instance of aggression. Explanation. This scenario presents a common implementation challenge for registered behavior technicians, RBT, when applying punishment procedures. The challenge lies in accurately and ethically implementing a procedure that, by its nature, aims to decrease a behavior by introducing an aversive stimulus or removing a desirable one. The RBT must balance the need for effective intervention with the ethical imperative to minimize harm and ensure client dignity. This requires careful observation, precise implementation, and continuous data collection to ensure the procedure is effective and not causing undue distress. The correct approach involves the systematic and ethical application of a negative punishment procedure, as outlined in the Behavior Intervention Plan, BIP. This approach is best professional practice because it adheres to the principles of applied behavior analysis and the ethical guidelines for RBTs. Specifically, it involves the removal of a preferred item, tangible reinforcer, contingent upon the occurrence of the target behavior, aggression. This is a direct application of negative punishment, aiming to decrease the future probability of aggression. The RBT's role is to implement this precisely as described in the BIP, collect objective data on the target behavior and the effectiveness of the intervention, and report any adverse effects or deviations. This aligns with the BACP RBT Ethics Code, which emphasizes client welfare, competence, and integrity in service delivery. An incorrect approach would be to implement a positive punishment procedure without explicit authorization or a clear rationale in the BIP. For example, administering a verbal reprimand or a brief timeout from an activity that the client does not find reinforcing. This would be a regulatory and ethical failure because it deviates from the authorized intervention plan and potentially introduces an unapproved aversive consequence. Furthermore, if the reprimand is delivered in a harsh or punitive manner, it could be considered unethical and harmful. Another incorrect approach would be to ignore the aggression and not implement any consequence, which would be a failure to follow the BIP and a dereliction of professional duty, potentially leading to the escalation of the behavior and harm to the client or others. This also violates the RBT's responsibility to implement interventions designed to benefit the client. The professional decision-making process for similar situations involves a thorough understanding of the BIP, including the specific target behaviors, the defined consequences, and the rationale for their selection. RBTs must be trained in the correct implementation of all procedures. When faced with a situation requiring a punishment procedure, the RBT must first confirm that the procedure is authorized in the BIP and that they have received adequate training. They must then implement the procedure consistently and objectively, collecting data to monitor its effectiveness and any potential side effects. Any concerns about the procedure's effectiveness, the client's response, or potential ethical issues should be immediately reported to the supervising BCBA. This ensures that interventions remain safe, effective, and ethically sound. Question 13. The monitoring system demonstrates a pattern of inconsistent data collection by a senior RBT on multiple clients, specifically noting instances where session notes appear to be completed retrospectively and do not accurately reflect the observed session activities. This raises concerns about the integrity of the data and potential ethical breaches. As a newly certified RBT who has observed similar inconsistencies, what is the most appropriate course of action? Option A. Continue to observe and document the senior RBT's behavior without reporting it to anyone. Option B. Discuss your concerns with other RBTs on the team to gauge their opinions before taking action. Option C. Directly confront the senior RBT about the observed data collection inconsistencies. Option D. Report the observed inconsistencies in data collection and session notes to your direct supervisor. The correct answer is D. Report the observed inconsistencies in data collection and session notes to your direct supervisor. Explanation. This scenario presents a professional challenge because it requires an RBT to navigate a situation where observed behavior may violate ethical standards and potentially client safety, while also considering the established reporting structure and the potential implications of their actions. The RBT must balance their direct responsibility to the client with their obligation to uphold professional conduct and report concerns appropriately. Careful judgment is required to ensure the client's well-being is prioritized and that reporting is done in a manner that is both effective and compliant with professional guidelines. The correct approach represents best professional practice because it directly addresses the observed behavior by reporting it through the established supervisory chain. This aligns with the ethical guidelines for RBTs, which emphasize the importance of reporting any behavior that may be unethical, illegal, or endanger the welfare of a client. By reporting to their supervisor, the RBT initiates a formal process for investigation and intervention, ensuring that the issue is handled by individuals with the authority and responsibility to address it appropriately. This upholds the principle of client protection and maintains professional integrity. An incorrect approach of ignoring the behavior is a significant ethical and regulatory failure. It violates the RBT's duty to protect the client and report concerns, potentially allowing harmful practices to continue unchecked. This inaction can lead to severe consequences for the client and undermine the credibility of the profession. Another incorrect approach, confronting the colleague directly without involving a supervisor, bypasses the established reporting structure and can escalate the situation unnecessarily. While direct communication can sometimes be effective in cases of potential ethical violations, it is crucial to follow the designated reporting channels to ensure proper documentation, investigation, and resolution. This approach risks creating conflict and may not lead to a resolution that protects the client. A third incorrect approach, documenting the behavior but not reporting it, fails to fulfill the RBT's obligation to act on observed ethical concerns. Documentation is important for record keeping, but it is insufficient on its own when the documented behavior suggests a violation of ethical standards or client welfare. The purpose of reporting is to trigger an appropriate response and ensure accountability. The professional decision-making process for similar situations should involve a clear understanding of the RBT's ethical obligations and reporting responsibilities. When an RBT observes behavior that raises ethical concerns, they should first assess the immediate risk to the client. If there is immediate danger, they should take steps to ensure client safety. Following this, they should consult their supervisor or the designated reporting person as outlined in their organization's policies and the BAC ethical code. The RBT should document their observations accurately and objectively, and then follow the established procedures for reporting. This systematic approach ensures that client welfare is protected and that ethical standards are upheld. Question 14. The audit findings indicate that during a recent session, a client became visibly distressed and disengaged when the registered behavior technician, RBT, began taking frequency data on a specific target behavior. The RBT continued to collect data for the remainder of the session, noting the client's distress in the session notes. Which of the following measurement and data collection approaches best aligns with RBT ethical and professional standards in this situation? Option A. Immediately stop collecting data for the session and reschedule for another time when the client is more amenable to data collection. Option B. Briefly pause data collection to re-engage the client and then resume collecting frequency data, potentially using a less intrusive method if possible, while documenting the adjustment. Option C. Discontinue frequency data collection for the remainder of the session and focus solely on implementing the intervention without any data recording. Option D. Continue collecting frequency data as planned, ensuring all instances of the target behavior are recorded, and note the client's distress in the session notes. Correct answer is B. Briefly pause data collection to re-engage the client and then resume collecting frequency data, potentially using a less intrusive method if possible, while documenting the adjustment. Explanation. This scenario presents a professional challenge because it requires the registered behavior technician, RBT, to balance the need for accurate data collection with the client's immediate comfort and engagement during a session. The RBT must make a judgment call on how to proceed when data collection methods might inadvertently disrupt the therapeutic process. Careful consideration of the RBT's ethical obligations and the principles of applied behavior analysis is paramount. The correct approach represents best professional practice because it prioritizes the integrity of the data while also demonstrating a commitment to client-centered care and the least restrictive methods. By briefly pausing data collection to re-engage the client and then resuming with a modified approach, the RBT upholds the BACP RBT ethics code, specifically the emphasis on client dignity and the importance of accurate, reliable data for effective intervention. This demonstrates a proactive and adaptive approach to data collection, ensuring that the data remains valid and useful for treatment planning and evaluation without sacrificing the therapeutic relationship. An incorrect approach that involves continuing to collect data without addressing the client's distress would be a failure to uphold the ethical principle of client dignity and welfare. This could lead to inaccurate data if the client's behavior is significantly altered by their discomfort, and it neglects the RBT's responsibility to ensure the client's well-being during services. Another incorrect approach, ceasing data collection entirely and not resuming, would compromise the integrity of the session's data, hindering the ability to track progress and make informed decisions about the intervention. This violates the RBT's responsibility to collect accurate and continuous data as outlined in the RBT task list. Professionals should use a decision-making framework that involves 1. Identifying the immediate problem, client distress impacting data collection. 2. Recalling ethical obligations, client dignity, data integrity. 3. Considering the least restrictive and most effective solution, brief pause, re-engagement, modified collection. 4. Implementing the chosen solution and monitoring its effectiveness. 5. Documenting the situation and the chosen approach. Question 15. Compliance review shows that during a session, a registered behavior technician, RBT, is implementing a task analysis for a client. The client begins to exhibit signs of distress, including vocalizations and attempts to disengage from the task. The behavior intervention plan specifies positive reinforcement for completing steps of the task analysis. The RBT is faced with the decision of how to proceed. Which of the following actions best aligns with RBT ethical standards and the principles of behavior analysis? Option A. Continue to prompt the client through the task steps as outlined in the plan and provide reinforcement for any successful engagement or completion of steps, while also noting the distress in session notes. Option B. Immediately stop the task and allow the client to engage in a preferred activity to reduce their distress, effectively reinforcing the escape behavior. Option C. Temporarily halt the session and implement a different, less demanding task with a higher reinforcement rate, without consulting the supervisor. Option D. Ignore the client's distress and continue prompting aggressively until the task is completed, without any adjustment. Correct answer is A. Continue to prompt the client through the task steps as outlined in the plan and provide reinforcement for any successful engagement or completion of steps, while also noting the distress in session notes. Explanation. This scenario presents a common implementation challenge in behavior technician practice. Ensuring reinforcement strategies are applied consistently and ethically, particularly when dealing with a client's immediate distress. The challenge lies in balancing the immediate need to reduce aversive stimulation, negative reinforcement, with the long-term goal of teaching adaptive behaviors through positive reinforcement, all while adhering to ethical guidelines and the BACP RBT standards. The professional must make a judgment call that prioritizes the client's well-being and the integrity of the behavior plan. The correct approach represents best professional practice because it prioritizes the established behavior intervention plan and the ethical principle of providing effective services. By continuing to prompt the client to engage in the target behavior and reinforcing that engagement, the technician is upholding the plan designed to increase a desired skill. This aligns with the BACP emphasis on data-driven decision-making and the systematic application of behavior analytic principles. The reinforcement of the target behavior, even in the presence of distress, is a form of positive reinforcement that strengthens the desired action. While the client's distress is noted, the plan's integrity is maintained by not immediately removing the task, which would be negative reinforcement for escape/avoidance, without a clear, data-supported reason or supervisory guidance. An incorrect approach that immediately removes the task upon the client's distress is a failure to adhere to the behavior intervention plan and a potential misuse of negative reinforcement. This action, while seemingly compassionate in the moment, reinforces the escape or avoidance behavior, making it more likely the client will exhibit distress to avoid tasks in the future. This directly contradicts the goal of teaching and increasing adaptive behaviors. Ethically, it could be considered a failure to provide competent services as outlined by the BACP, as it deviates from a planned intervention without proper justification or supervision. Another incorrect approach, such as ignoring the distress and continuing to prompt without any adjustment or consideration for the client's state, demonstrates a lack of sensitivity and potentially a failure to recognize when a plan might need modification or when the client's distress is escalating to a point of harm or significant discomfort. While not directly a misuse of reinforcement, it can be seen as a failure to implement services with appropriate care and attention to the client's overall well-being, which is an ethical consideration. A third incorrect approach, such as abruptly changing the reinforcement schedule without supervisory consultation or data to support the change, also violates professional standards. Reinforcement schedules are carefully designed components of behavior plans. Unilateral changes can undermine the effectiveness of the intervention and are not in line with the collaborative and data-informed nature of behavior analysis practice. This demonstrates a lack of adherence to the established plan and a failure to seek appropriate guidance. The professional decision-making process in such situations involves 1. Prioritizing the client's safety and well-being. 2. Adhering to the established behavior intervention plan. 3. Collecting objective data on the client's behavior and the effectiveness of the intervention. 4. Recognizing when a situation may require modification of the plan or additional support. 5. Communicating any challenges or deviations from the plan to the supervising BCBA promptly. 6. Seeking supervision and guidance before making significant changes to the intervention. Question 16. Assessment of a client's behavior involves observing and recording their actions. Which of the following represents a behavior that is most appropriate for an RBT to directly measure and record? Option A, the client's private thought about wanting a snack. Option B, the client's observable act of throwing a toy. Option C, the client's internal feeling of frustration. Option D, the client's subjective interpretation of a social situation. The correct answer is C, the client's internal feeling of frustration. Explanation. This scenario presents a common challenge for registered behavior technicians, RBT, in distinguishing between observable and internal behaviors, which is fundamental to accurate data collection and intervention planning. The professional challenge lies in the RBT's responsibility to objectively measure behavior for effective service delivery, as mandated by ethical standards and regulatory guidelines. Misclassifying a behavior can lead to inaccurate assessments, ineffective treatment plans, and potentially compromise client progress and safety. The correct approach represents best professional practice because it adheres to the core principles of applied behavior analysis, ABA, and the RBT ethical standards. Specifically, it aligns with the BACP RBT handbook, which emphasizes the importance of defining and measuring observable behaviors. Overt behaviors are directly perceivable and measurable, allowing for reliable data collection. Covert behaviors, while important, require indirect measurement strategies or are typically assessed by individuals with higher levels of licensure. By focusing on overt behaviors, the RBT ensures that their data collection is objective, verifiable, and directly supports the implementation of the behavior intervention plan. This aligns with the ethical obligation to provide competent services and maintain accurate records. An incorrect approach that focuses solely on internal thoughts or feelings without an observable manifestation fails to meet the RBT's scope of practice. RBTs are trained to observe and record overt behaviors. Attempting to directly measure or interpret covert behaviors, such as feeling sad, without observable indicators like crying or withdrawal, is outside the RBT's purview and can lead to subjective interpretations rather than objective data. This violates the principle of objective measurement and can lead to misinformed intervention strategies. Another incorrect approach might involve inferring covert behaviors from overt ones without explicit instruction or supervision from the supervising BCBA. While overt behaviors can sometimes be indicators of covert states, an RBT's role is to record the observable, not to diagnose or interpret internal states without a clear, data-driven protocol established by the supervisor. This can lead to overgeneralization and inaccurate data. The professional decision-making process for similar situations involves a clear understanding of the RBT's defined role and responsibilities. When faced with a behavior that might be covert, the RBT should first consider if there is an observable, overt component that can be measured. If the behavior is purely internal and not directly observable, the RBT should consult their supervising BCBA for clarification on how to proceed. This might involve developing specific operational definitions for observable correlates of the covert behavior, or it might be determined that the assessment or intervention of that specific behavior is outside the RBT's direct scope and requires the expertise of the BCBA. This collaborative approach ensures that data collection remains objective, ethical, and aligned with the client's treatment plan. Question 17. Comparative studies suggest that the accuracy of behavioral data collection can be influenced by various factors. An RBT is collecting data on the frequency of a child's aggressive outbursts during a play session. The RBT notices that the child is exhibiting a significant increase in aggressive behaviors today compared to previous sessions, which is concerning. However, the RBT also knows that the child's parents are very anxious about the aggression and have expressed a strong desire to see immediate improvement. The RBT feels a personal urge to focus the data collection primarily on the brief moments of positive interaction that are also occurring, to present a more encouraging picture to the parents. What is the most ethical and professional approach for the RBT in this situation? Option A. Record data based on the RBT's subjective interpretation of the child's emotional state, assuming that the increased aggression is temporary and not a true reflection of the child's progress. Option B. Meticulously record the frequency of all aggressive outbursts as defined, along with any other relevant observable behaviors, without omission or alteration, and discuss the findings with the supervising BCBA. Option C. Alter the definition of aggressive outburst mid-session to exclude less severe instances, thereby reducing the recorded frequency. Option D. Focus data collection on the positive interactions observed, minimizing the recording of aggressive outbursts to avoid causing undue distress to the parents. The correct answer is B. Meticulously record the frequency of all aggressive outbursts as defined, along with any other relevant observable behaviors, without omission or alteration, and discuss the findings with the supervising BCBA. Explanation. This scenario presents a common ethical challenge in data collection, where the integrity of the data might be compromised by the observer's personal biases or a desire to present a specific outcome. The RBT must navigate the conflict between their role as an objective data collector and potential external pressures or personal inclinations. Careful judgment is required to ensure that the data accurately reflects the client's behavior, upholding the principles of ethical practice and client welfare. The correct approach involves meticulously recording all observed behaviors, both those targeted for intervention and any other relevant behaviors, without omission or alteration. This aligns with the BACP ethical code, specifically the emphasis on accurate and objective data collection, e.g., Section 1, Zero data collection, measurement, and reporting. By documenting all relevant occurrences, the RBT provides a comprehensive and unbiased picture of the client's progress, which is crucial for effective treatment planning and evaluation. This approach ensures that decisions about the intervention are based on factual evidence, promoting client progress and safety. An incorrect approach would be to selectively record only the behaviors that demonstrate progress or to inflate the frequency of desired behaviors while omitting or downplaying undesired ones. This constitutes data falsification, a serious ethical violation. Such actions undermine the scientific integrity of behavior analysis and can lead to inappropriate treatment decisions, potentially harming the client by prolonging ineffective interventions or failing to address critical needs. This directly contravenes the RBT's responsibility to maintain accurate records and to act in the client's best interest. Another incorrect approach would be to alter the definition of a target behavior mid-session to better fit observed actions, or to record data based on assumptions about the client's internal state rather than observable behavior. These actions violate the principles of objective measurement and can lead to unreliable data. The RBT's role is to measure observable behavior as defined, not to interpret or redefine it based on perceived intent or desired outcomes. This compromises the validity of the data and the effectiveness of the intervention. Professionals should approach data collection with a commitment to objectivity and accuracy. When faced with challenging observations or potential biases, the decision-making process should involve 1. Adhering strictly to the defined measurement procedures. 2. Documenting all observed behaviors objectively. 3. Seeking supervision if unsure about how to record a specific behavior or if personal biases are suspected. And 4. Prioritizing the client's welfare by ensuring data integrity above all else. This systematic approach ensures that data collection remains a reliable tool for understanding and improving client outcomes. Question 18. The efficiency study reveals that a client's progress on a specific skill acquisition program is significantly slower than anticipated based on baseline data and typical intervention outcomes. The RBT has been diligently implementing the program as written for the past 3 weeks. What is the most ethically and professionally appropriate next step for the RBT? Option A. Immediately suggest to the supervising BCBA that a completely different, novel intervention be tried, based on a recent article the RBT read. Option B. Make minor, unapproved modifications to the intervention procedures to try and elicit a faster response from the client. Option C. Continue implementing the intervention exactly as written for another month to ensure sufficient fidelity before considering changes. Option D. Document the observed progress and any implementation challenges, and schedule a meeting with the supervising BCBA to discuss the data and collaboratively problem-solve potential adjustments to the intervention plan. The correct answer is C. Continue implementing the intervention exactly as written for another month to ensure sufficient fidelity before considering changes. Explanation. The efficiency study reveals that a particular intervention for a client with autism spectrum disorder is yielding slower than expected progress. This scenario is professionally challenging because it requires the registered behavior technician, RBT, to balance the client's immediate needs and progress with the ethical imperative to use evidence-based practices and ensure client well-being. The RBT must critically evaluate the intervention's effectiveness without resorting to potentially harmful or unethical shortcuts. The correct approach involves collaborating with the supervising BCBA to analyze the data, identify potential barriers to progress, and collaboratively revise the intervention plan. This aligns with ethical standards that mandate data-driven decision-making, ongoing assessment, and the principle of beneficence, acting in the client's best interest. The RBT's role is to implement interventions as designed and report observations and data accurately, but also to contribute to the problem-solving process under BCBA supervision. This collaborative approach ensures that any changes to the intervention are based on a thorough understanding of the client's behavior and are consistent with best practices in behavior analysis. An incorrect approach would be to unilaterally alter the intervention without consulting the BCBA. This violates the RBT's scope of practice and ethical guidelines, which require RBTs to work under the supervision of a BCBA and implement interventions as directed. Now, such an action could lead to a decrease in treatment integrity, potentially harm the client by implementing an ineffective or inappropriate intervention, and undermine the therapeutic relationship. Another incorrect approach would be to continue implementing the intervention without modification, despite the lack of progress, ignoring the data, and failing to act in the client's best interest. This demonstrates a lack of adherence to the ethical principle of providing competent services and a failure to monitor and adjust interventions as needed. Finally, recommending a completely different, unproven intervention without the BCBA input or a systematic review of evidence would also be ethically unsound, as it bypasses the established process for intervention selection and validation. Professionals should approach such situations by first meticulously reviewing the collected data and comparing it against the established goals. They should then document all observations related to the intervention's implementation and the client's response. The next critical step is to communicate these findings and concerns clearly and promptly to the supervising BCBA, presenting the data and observations objectively. The RBT should be prepared to discuss potential reasons for the lack of progress and to collaborate with the BCBA on developing a revised plan, which may involve modifying the current intervention, collecting different types of data, or exploring alternative strategies under BCBA guidance. Question 19. To address the challenge of gathering comprehensive and objective data for a functional behavior assessment, FBA, in a potentially distracting environment, which approach best ensures the integrity of the assessment process and informs effective intervention planning? Option A. Conduct multiple direct observation sessions, systematically recording antecedents, behavior, and consequences using an appropriate measurement system, and triangulate findings with indirect assessments. Option B. Perform a single, brief direct observation session to get a general sense of the behavior and then proceed with intervention development. Option C. Rely primarily on caregiver interviews and historical records to infer the function of the behavior, as direct observation may be too disruptive. Option D. Immediately implement a common intervention strategy for the suspected behavior without completing a full FBA. The correct answer is A. Conduct multiple direct observation sessions, systematically recording antecedents, behavior, and consequences using an appropriate measurement system, and triangulate findings with indirect assessments. Explanation. This scenario presents a professional challenge because the RBT is tasked with gathering information for a functional behavior assessment, FBA, in a setting where direct observation might be limited or influenced by external factors. The RBT must ensure the data collected is accurate, reliable, and ethically obtained to inform an effective intervention plan. The core of the challenge lies in balancing the need for comprehensive data with the practical constraints of the environment and the client's well-being. The correct approach involves systematically collecting data through multiple methods, prioritizing direct observation and objective measurement. This aligns with the BACP RBT task list, which emphasizes the importance of accurate data collection for FBAs. Specifically, the RBT is expected to conduct direct observation, record antecedents and consequences, and use objective measurement systems. This method ensures that the assessment is grounded in observable behavior, minimizing subjective interpretation, and increasing the likelihood of identifying the true function of the behavior. This approach is ethically sound as it prioritizes objective data to benefit the client and adheres to professional standards for assessment. An incorrect approach would be to rely solely on anecdotal reports from caregivers without direct observation. This fails to meet the RBT's responsibility to collect objective data as outlined in the RBT task list. Relying on subjective accounts can lead to inaccurate conclusions about the function of the behavior, potentially resulting in an ineffective or even harmful intervention plan. This also risks misinterpreting the behavior due to caregiver bias or incomplete recall. Another incorrect approach would be to conduct a brief, superficial observation without systematically recording antecedents and consequences. This would not provide sufficient information to hypothesize the function of the behavior. The RBT task list requires detailed recording of the environmental context surrounding the behavior. Without this, the assessment is incomplete and does not fulfill the purpose of an FBA, which is to understand the relationship between the behavior and its environment. A further incorrect approach would be to immediately implement an intervention based on a preliminary hypothesis without completing the full FBA process. This bypasses the critical step of data collection and analysis, which is essential for developing evidence-based interventions. It is premature and unprofessional to intervene without a thorough understanding of the behavior's function, potentially leading to ineffective strategies and a failure to address the client's needs effectively. This violates the principle of data-driven decision-making central to behavior analysis. A professional decision-making process for similar situations should involve a clear understanding of the RBT's scope of practice and the requirements of an FBA. The RBT should first identify the target behavior and the context in which it occurs. Then, they should select appropriate data collection methods, prioritizing direct observation and objective measurement. This includes defining the behavior operationally, choosing a measurement system, e.g., frequency, duration, interval recording, and systematically recording antecedents and consequences. If limitations exist for direct observation, the RBT should communicate these to their supervising BCBA and explore alternative, ethically sound data collection strategies, always prioritizing objective data. The process should be iterative, with data informing the hypothesis and further data collection refining it, until a clear understanding of the behavior's function is achieved. Question 20. Operational review demonstrates that a registered behavior technician, RBT, is working with a family from a cultural background with different disciplinary practices than those outlined in the current behavior intervention plan. The parents express discomfort with some of the planned interventions, stating they do not align with their family's values and beliefs about child rearing. The RBT observes that the parents are less engaged and compliant with the intervention when these specific procedures are to be implemented. What is the most appropriate course of action for the RBT? Option A. Schedule a meeting with the supervising BCBA to discuss the parents' concerns, explore the cultural context, and collaboratively determine if modifications to the intervention plan are necessary and ethically appropriate. Option B. Continue implementing the intervention plan as written, explaining to the parents that these are evidence-based practices and that adherence is crucial for the child's progress. Option C. Inform the parents that their cultural beliefs are not compatible with the intervention and suggest they seek services elsewhere if they cannot comply. Option D. Independently adjust the intervention plan based on the RBT's understanding of the parents' concerns, without consulting the supervising BCBA or the parents further. The correct answer is A. Schedule a meeting with the supervising BCBA to discuss the parents' concerns, explore the cultural context, and collaboratively determine if modifications to the intervention plan are necessary and ethically appropriate. Explanation. This scenario presents a professional challenge because the registered behavior technician, RBT, is encountering a family whose cultural practices regarding child rearing and discipline differ significantly from the behavior analytic interventions being implemented. The RBT must navigate these differences with sensitivity and respect while upholding ethical standards and ensuring the client's well-being and progress. The core of the challenge lies in balancing the fidelity of the intervention plan with the family's cultural context and their active participation in the treatment process. The correct approach represents best professional practice because it prioritizes open communication, collaboration, and a genuine effort to understand the family's perspective. This aligns with the BACP ethical guidelines, which emphasize the importance of respecting client dignity and autonomy and working collaboratively with clients and stakeholders. Specifically, the RBT is demonstrating cultural competence by seeking to understand the family's values and beliefs, and by being willing to adapt the intervention in a way that is culturally responsive and acceptable to the family, without compromising the core principles of behavior analysis or client safety. This approach fosters trust and increases the likelihood of successful treatment outcomes by ensuring family buy-in and adherence. An incorrect approach that involves dismissing the family's concerns or insisting on the original plan without further discussion fails to acknowledge the importance of cultural factors in treatment. This would be a violation of ethical principles related to client dignity and autonomy and could lead to a breakdown in the therapeutic relationship. It also demonstrates a lack of cultural competence, which is a professional expectation for RBTs. Another incorrect approach, such as unilaterally altering the intervention plan without consulting the supervising BCBA or the family, would be a breach of professional boundaries and the RBT's scope of practice. The RBT is responsible for implementing the plan as designed by the BCBA and for seeking guidance on modifications. This approach also bypasses the crucial step of understanding the family's perspective and obtaining their consent for any changes. A third incorrect approach, such as avoiding the topic or continuing with the intervention despite the observed conflict, is professionally unacceptable as it neglects the client's and family's needs and the ethical imperative to address issues that may impede treatment progress. This passive approach can lead to increased family dissatisfaction, reduced engagement, and potentially harm to the client if the intervention is not being implemented effectively due to cultural misunderstandings. The professional decision-making process for similar situations should involve 1. Recognizing and acknowledging the cultural differences and potential conflicts. 2. Initiating open and respectful communication with the family to understand their perspective, values, and concerns. 3. Consulting with the supervising BCBA to discuss the situation, seek guidance, and explore potential modifications to the intervention plan that are culturally sensitive and ethically sound. 4. Collaborating with the family and BCBA to develop a revised plan that respects cultural values while maintaining the integrity and effectiveness of the behavior analytic approach. 5. Documenting all discussions, decisions, and plan modifications.